So nurses are involved in the administration, management, and assessing the complications of CAR T-cell patients. So they're really at the forefront of managing these patients and hopefully getting them through the entire process, because the process can be quite long. Prior to initiation, we really need to make sure that the hospital has established protocols for the incoming CAR T patients. For our institution, we did do a couple things that we wanted to make sure would be ready by the time we had these CAR T patients. So one of them is establishing a CRS attending schedule, making sure that there was a physician that knew what CRS meant and how to manage it. We also used our electronic medical system so that we were able to flag these CAR T patients, so people or healthcare providers taking care of them are able to identify that these are CAR T-cell patients. We also had to work with the emergency department, with the ICU, and different departments really of our hospital to be able to make sure that we had the adequate resources to take care of them. We also had to develop a protocol for patients that are outpatient. If they had a fever or had any CRS symptoms related to CAR T-cell therapy, that they would bypass the emergency room and come straight in so that they can be managed appropriately. After that, the whole procedure itself, going from leukapheresis all the way to the infusion of the cell, takes about 2 months. So we do need nurses to continue to keep open communication and patient education with both the patient and the caregiver. So they're involved in every step of the process, from leukapheresis to bridging therapy to lymphodepleting chemotherapy to the actual infusion of the CAR T cells. And then just because it's a single infusion, it doesn't mean that there's nothing to be done afterwards. So a lot of it involves coordinating with the patient and the caregiver, how many visits they're going to have to come in for supportive care, even long-term side effects. We're seeing patients that are a couple months out, even up to a year out, who are still requiring supportive care. Not necessarily treatment for myeloma, but they do need to come in for transfusions, growth factor support, just visits to make sure that they're not having any infections. I did want to mention that social work is very important in this. They really help with the patients and the caregivers in managing logistics, because it is going to be frequent visits to the hospital. A lot of these patients are coming from out of state or from far away places, and they really need to find help with they really need the social worker to help them with the logistics of finding a place to stay, hotel, transportation. These things all add up, and the social worker is imperative. I think the biggest way we can overcome these challenges is really to have a multidisciplinary approach. So not only nursing and social work, but involving other healthcare providers in managing the patients, and obviously better communication with the patients, because if they know what to expect, there's more adherence to the protocol, and then you have better outcomes.